Thank you. It's a real honor to be invited here, and what a impressive place and beautiful city, of course. So since he wanted Dr. Wiener to talk, I thought this would be a good topic. First of all, I'm just, when I agreed to do this, I thought it might be easy to cross the border, but I was a little concerned on recent days that I fortunately was able to get across the wall and into Canada. I'm a visiting professor, so I have to show the usual photos of where I came from. Actually, last Friday I was in clinic in that glass building while Dr. Galib was down the street talking about prostate cancer. And actually I was doing circumcision, so I couldn't run down the street. But really, we work in a big pine forest. It's kind of amazing that there's this big medical center and mostly a big pine forest. But Mr. Duke made a lot of money selling cigarettes, and that's where the money came from. American Tobacco controlled like 95% of the world's cigarette business at one point. So he gave the money, and this is the entrance to the medical school on the main campus. And it really is a beautiful campus with this big Gothic cathedral. So it's a neat place to work, and I went to college there, and Thomas had to pin me down that yes, I am a Duke basketball fan. So disclaimers, when you talk, you got to talk about your financial disclosures, but when you talk about circumcision, everybody's got an opinion. So let me give you a few more disclaimers. I am male, and I am Jewish, and that's going to be important. And most importantly, when somebody's talking about circumcision, you really need to know. Everybody should just drop their pants. And so maybe more information you want to know about me. But so I'm going to talk about the history of circumcision, both the religious and medical parts of it, as well as some current recommendations and current controversies. And then I'll talk a little bit about care of the circumcised and intact penis. So we all have biases. I've got mine, you've got yours, and then the boy's family is going to have theirs. And you have to consider that when you talk about circumcision, because we have religious biases, medical ones, as well as cultural ones, which are probably the most important. In setting up this talk, I was like, well, I was looking for a picture of a condom with maple leaves on it. This is as close as I could get. But I did like it that it said that's required for entry. But I did want to think about the way, learn about what you do in Canada. And so actually this was very fortuitous that this special edition came out a couple months ago. And there are a couple articles in there on preputial health and childhood circumcision in Canada, and then an overview by Samid. So I learned a little bit. So the balance of evidence in a Canadian context led Canadian Pediatric Society to maintain the position that circumcision of the newborn should not be routinely performed. And in 2015, they came out with this policy statement. We'll talk about a bunch of different policy statements. So I look back, and our friend Peter Metcalf, he surveyed Canadian pediatric urologists and found similarity, and that fairly that most Canadian pediatric urologists are not pushing to have everybody circumcised. I was looking for newborn circ rates in Canada, and back in 1970 it was fairly high, but it was like in the U.S. Geographically divergent, and probably the Quebecois are the least, but it's been dropping in Canada, so that in 2007 it said about 30% of males over 15 are circumcised. So it appears that most Canadians are living with their prepuce, and for the 30 to 32% of Canadians who may not retain their prepuces for life as a result of substitute decision, obviously the newborns aren't making that decision, or consent for circ, adequate provision of good, affordable, accessible, culturally sensitive, non-discriminatory, and safe care should be available. So let's talk about some history. How did we get to that? So these Egyptian photos, they've been doing it for millennia. Actually, it's thought to have begun in Australia in about 10,000 BC. Africa 6,000 BC in the Middle East and Egypt, 2300.
It's all about Australia way back then. What dates it back that far? Mummified remains or something?
Yeah, because they didn't have written language, but so I'm not sure if they found little foreskins dried up. But it's done in cultures all over the world. But these are all done sort of as usually a right to manhood. And it's really only in Judaism that it was begun in infants. Here's a ceremony in an African tribe from National Geographic. And it's often done around 13, sort of like a bar mitzvah. So we live in a fairly Judeo-Christian world here in North America. And so we go back to Genesis, and God says to Abraham, I will make my covenant between me and thee. Thou shalt be a father of multitude of nations, and I will make thee exceedingly fruitful, and I will make nations of thee, and kings shall come of thee. That sounds like a pretty good deal. But, hey God, what's the catch? So it goes on to say, this is my covenant which ye shall keep between me and you and thy seed after thee. Every male among you shall be circumcised. And ye shall be circumcised in your flesh of your foreskin, and it shall be a token of a covenant between me and you. And he that is 8 days old shall be circumcised among you, every male throughout your generations. My covenant shall be in your flesh. So this is really something that's not irrevocable, or something that's not revocable. For an everlasting covenant. And Abraham then goes on to circumcise himself at age 99. Ishmael, who sort of leads the Muslim world branch, at 13. All the men of his house, including the slaves. And then later his son Isaac. And there's a story of that he's going to sacrifice Isaac. I was visiting my daughter who was studying in Italy last year and saw this statue by Donatello of him about to sacrifice Isaac. And this is a Rembrandt where he's about to sacrifice Isaac and drops the knife. And you can see sort of where the knife is, that it may be about to do a circumcision if it falls in the wrong place. So this young Jewish boy is going to get circumcised. And then there was this other Jewish boy who was born several later. And so in the New Testament, in Luke, it says, and at the end of 8 days, when he was circumcised, he was called Jesus. So it becomes an interesting historical thing because if you're a Christian, did the resurrection of Christ herald a new religion, or was it a revitalization of Judaism? Did you need to become Jewish to become Christian? Because if you did, then you need to be circumcised, right? So Paul writes in multiple places that he insists it's a new religion. And so you don't have to be converted to Judaism to become a Christian. That's important because circumcision was a formidable barrier. They weren't going to get a bunch of Romans to become Christian if they all had to be circumcised. So Paul politically found a workaround. So that thus begins a debate over circumcision that continues today. So if you look at Christian history, there's something called the carnivore sanctum, which is very holy meat. And it's supposedly the relic of Jesus' foreskin. Supposedly it's in the Vatican, floating in oil with his umbilical cord. But then there's also the monastery of Chiraut, which means red flesh. In France, they say they have it. And then other places in France, Belgium, Germany, and Italy all say they have it. So I don't know if they cut it in little pieces. But we actually have an exhibit of Venetian art in North Carolina right now, and I went there with my daughter. And looking at the picture of Jesus and Mary. And when you look closely, that's not a circumcised penis. Because really in Italy, they don't know that's what normal is in Italy. So it actually turns out that Catholic dogma held that Jesus ascended to heaven perfect in every way, and that would perfect would mean with an intact penis. And so in 1900, the Vatican made a ruling that anyone referring to the carnivore sanctum would be excommunicated. Let's talk about Jewish history. So the diaspora, as the Jews left the Middle East, circumcision became a sign of Jewish identity. And I read a document that said it provided the ability to preserve national identity. It endured over generations of Jews living among Gentiles. it resisted assimilation, and it allowed the Jewess to identify Jewish males. Well, in Jewish history in the 2nd to 6th centuries, rabbis would sit around and debate stuff. And they wrote these books as they spread around the old world, and they interpreted traditional Judaism, and they recorded it in these 3 books called the Mishnah, the Talmud, and the Midrash. And they developed some new traditions, and they changed the Brit Milah, or the bris. Originally, they just kind of did a partial circumcision, removing the skin distal to the glands. But they added the perial, where they began to tear the prepuce off with their thumbnails and remove the entire prepuce. And then, this was all new to me, the metzitza, where they actually would suck the blood from the wound. That growing up in Mississippi, that did not happen. And in the Mishnah, they say they do prepare all that is needed for circumcision on the Sabbath. They, number 1, cut, number 2, tear, number 3, suck, and they put on it a poultice and cumin, and then they wrap a rag around the wound of the circumcision. That sort of tells me they must have had some infection problems. They're putting these chemicals on it and wrapping a rag around it. And then they go on to say that great is circumcision. In the Talmud, there's a debate over the number of sons that must die as a consequence of circumcision before the next son is spared. So they understood mortality, that people died from it, probably hemophiliacs. So it's mentioned twice in the Talmud. One place it says that if 2 sons die, you don't have to circumcise the third. Another place it says it's 3 sons. In the Midrash, they say that circumcision, though, will lead to salvation, and we will not descend into Gehinnom, which is a Jewish hell, because we were circumcised. And on the day when the children of Israel went forth from Egypt, all the people were circumcised. It's Passover this week. I was taught that they sacrificed lambs and they marked it with the blood of the lamb, and that's why you always eat lamb on Passover. But according to these things, that they actually used blood from a circumcision and then marked the door, and God passed over the marked houses and plagued the Egyptians. Let's move forward in Jewish history to about 1200 with Maimonides. And he says, with regards to circumcision, one of the reasons for it is the wish to bring about a decrease in sexual intercourse. The fact that circumcision weakens the faculty of sexual excitement and sometimes perhaps diminishes pleasurable is indubitable. And it's hard for a woman with whom an uncircumcised man has had sexual intercourse to separate from him. This is 900 years ago he's writing this stuff. But then we move into the Middle Ages and circumcision becomes demonized. There was a lot of prejudice against Jews, and there were myths born that you needed Christian blood to do a circumcision and that you had to have a sacrifice of Christian boys. And so circumcision really became sinister, and most of Europe did not do it. But things changed in the 19th century. Jews became accepted into Western society. In America, we had the Declaration of Independence, where all men are created equal. In France, they had the French Revolution with Égalité, Fraternité, and Liberté. And in Germany, the Jewish Enlightenment, where my ancestors moved out of traditional Judaism into Reform Judaism. And they abandoned anachronistic practices, so they were no longer kept kosher. They didn't wear traditional Jewish clothing, didn't live in ghettos. My ancestors worked on Saturday because they had to sell things. But what was interesting is they didn't abandon circumcision. So also about this time, medicine became much more scientific. They began to worry about things like morbidity and mortality. In Vienna, they noted that one moil had 100% mortality. If you think about it, they're sharpening their thumbnails to take the foreskin off. They probably didn't wash their hands very well. And then for doing the metzitza, their mouth and gums are covered with anaerobes and TB and syphilis and whatever. And this led Dr. Jaffe to say that it is impossible to demand abandonment of a ritual that has existed for millennia, but it must be demanded, however, that this be performed in a manner that endangers neither the life or health of children. So this is really as medicine is becoming recognizable to us. In the metzitza, Dr. Kahn realized that maybe that's not a very healthy thing to do, so he designed a small glass tube to enable the moil to suck blood without mouth-to-penis contact. And by the turn of the century, it was adopted across Europe. And the internet's great, so I was able to find a picture of a Folda tube. But it's fun to learn about history, but it's, the old adage that those who don't know history are doomed to repeat it. So look in Time magazine from 2012, and how 11 New York City babies contracted herpes through circumcision, and they're in these very ultra-Orthodox communities. They were doing the mitzitza, and going back to what we learned back in the 19th century, you shouldn't do. So things began to change in America, and many Jews weren't circumcised in the 19th century because there weren't moils, and they had problems within a month. Some half-dozen deaths have occurred in New York City from hemorrhage after circumcision of Hebrew infants. And we see the first informed consent for circumcision in 1891. So in America and Britain, there was a lot of adoption of circumcision by Gentiles for medical and hygienic benefits. They like this word hygiene a lot. In 1885, there were 2 mohels in Atlanta who performed 2/3 of their circumcisions on Gentiles. And at this time, you have the Victorian notions of sexual morality. Hygiene becomes a really public health concern, and there's some bad science going on. This led the medical profession to calls for universal infant circumcision, at least in the United States. And why did that happen? Well, again, you got the Victorian morality. Galen's life forces, people still believed in that. You have the rise of public health, the germ theory. People began to realize that infection happens because of microbes. And then people began to trust doctors, what they said. We weren't just barber surgeons. And bring this all together, and circumcision rose at this time. So the Victorian era, they had class prejudice, and they believed the lower class had poor hygiene and sexual immorality, and that led to susceptibility to disease with dysfunctional sexual organs, and that masturbation would cause impaired growth, physical weakness, impotence, ulcers, epilepsy, and early deaths. So masturbation was evil, but also semen was thought to be a life force. Still, people believed in Galen's theories, and that semen was a precious substance in limited supply, couldn't be wasted. And so there's this term in the medical literature called spermatorrhea, that there's seminal loss with promiscuity, masturbation, or nocturnal emissions, and this is something that needed to be stamped out, and doctors needed to prevent this. And so they thought that if boys were retracting their foreskin, that would feel good and they would masturbate. So if you got rid of the foreskin, boys wouldn't masturbate. Made sense, right? So public health could be improved by eliminating this cause of spermatorrhea. And you go back to the late 19th century and you see ads for things like this, that you wear this, it prevents night emissions by arousing the wearer. I found this on the AUA history website, that they were really trying to prevent spermatorrhea. The germ theory, Pasteur and Koch wrote their papers in the 1870s, 1880s, and it was thought that the soft surface of the glands in prepuce were vulnerable to abrasion and germ penetration. And Dr. Hutchison at the Metropolitan Free Hospital in London said he looked at the prevalence of syphilis, and in the Gentiles it was 50% or 60%, and the Jews was only 19%. So he kind of concluded that it must be protected, but he did ignore that there was a higher prevalence of gonorrhea among the Jews. So he's just kind of cherry-picking your data to prove your point. And you look at Dr. Hutchison, he said that circumcision was by divine command made obligatory upon the Jews, not solely as religious ordinance, but also with a view to the protection of health. One is left to ask, witnessing the frightful ravages of syphilis in the present day, whether it might not be worthwhile for Christians also to adopt the practice. And if you look at Dr. Hutchison here and you look at his gaunt cheeks, I'm not sure he didn't have syphilis at some point. Louis Sayre is was president of the American Medical Association in 1880. He was one of the fathers of orthopedic surgery, and he helped found Bellevue Hospital, which is a big public hospital in New York. And just looking at some of his articles on the deleterious results of a narrow prepuce and preputial adhesions, partial paralysis from reflex irritation caused by congenital phimosis and inherent prepuce, and spinal anemia, whatever that is, with partial paralysis and want of coordination from irritation of genital organs. So he was writing in what was the predecessor of JAMA and the Transactions of the American Medical Association that you need to do circumcision to cure these diseases. he said that paralysis was cured by quieting his nervous system by relieving his imprisoned glans penis. He also cured spinal anemia, paralytic club foot, hernia, bladder inflammation, TB, scoliosis, epilepsy, and insanity. But not prostate cancer, I guess. So he advocated loosening the prepuce from the glands and not unjustifiable mutilation, but we Americans believe more is better, and so it became more of the of widespread adoption and removal of the entire foreskin. Well, at the same time in America, we had a growing Jewish influence, and this back to England. Dr. Hutchinson said, "No one who has seen the superior cleanliness of a Hebrew penis can have avoided a very strong impression in favor of removal of the foreskin." And he said that Jews had superior overall health and longevity, freedom from venereal disease, and disinclination from criminality, debauchery, and intemperance. And so he believed that circumcision was what led to all of this. So as circumcision gets brought into modern times, there were an increasing number of Jewish doctors, and they had more influence. And I'm going to talk about three of them: Abraham Wolburst, Abraham Ravich, and Ernst Wynder. And here's Dr. Wolburst in New York doing what I guess is urethrooscopy. But he wrote an article in 1914 in JAMA, which it's interesting to go back and read, and I have. And the title is Universal Circumcision as a Sanitary Measure. So this is written in the leading medical journal of the day. And it's a great aid to cleanliness. It's a prophylaxis against a variety of venereal diseases. It causes a diminished tendency to masturbation. And therefore, it is the moral duty of every physician to encourage circumcision in the young. He wrote in Cancer, is circumcision a prophylaxis against penile cancer? I love his quotes here. The prepuce is an ideal cancer grower. It furnishes and retains the essential irritating secretions which accumulate in the preputial cavity and there fructify into full blossom cancer. And the prepuce is a absolutely dangerous and serious menace to present day man. It'd be fun to be able to write in medical journals this type of stuff today. In Lancet, he sent a questionnaire to all skin and cancer hospitals, all Jewish hospitals, and 1,250 of the largest general hospitals. And he got questionnaires back of 1,103 cases of penile cancer, and only one was in a Jewish man who was uncircumcised, and therefore it must be protected. Ravich was a urologist, and he wrote, does it prevent prostate cancer? Again, I don't know about your institution, but my institution, every talk has to include prostate cancer. So I give you a little bit of that. So in New York City, the Jewish doctors pretty much only see Jewish patients. So here's his practice, which was about 90% Jewish, and he had about 90% Jewish patients and 10% Gentile patients that he treated for BPH over a 12-year period, and he found prostate cancer in 20% of the Gentiles and only 1.2% of the Jews, and therefore it must be circumcision that's preventing prostate cancer. And this is in the Journal of Urology. And then he said that few Jewish women develop cervical cancer, therefore the best prophylactic measure would be more universal practice of circumcising male infants. Wynder got out of Germany in the 30s and went to med school in St. Louis. He was a big researcher in linking lung cancer and smoking, but he was interested in preventing all kinds of cancer. And so this is in the GYN literature, looking at circumcision and cervical cancer. And really the evidence was pretty equivocal for a link between lack of circumcision and cervical cancer in the partners, but that didn't keep him from advocating newborn circumcision, particularly for low-income groups, as the best way to promote good personal hygiene. So I keep hearing these kind of universal themes that you could never write about today. So let's review. So there was a prevalence of circumcision rose at a time when there was a fear of infection and no reliable antibiotics. There was later fear of cancer and no reliable prophylaxis or treatment. And even in today's era, we have a fear of AIDS with no true cure. And this occurred at a time when the medical literature was based more on opinion than fact. They really didn't know anything about biostatistics, statistical significance, or confounding variables. So it sort of led up to a perfect storm which hijacked the scientific process. So I really got interested in this topic when I saw this article It was in JAMA, and the dotted line is the number of Americans born in hospitals. And you can see that the rate of circumcision sort of paralleled that because doctors were there and they could do something. So, but in 1930 it was about 30%. Well, if you look at the Brits, it was about the same. But after the National Health Service quit paying for circumcision, it's under 10%. So you have two countries fairly similar that started at 30% and went in divergent ways. And really fascinating. In the U.S., it peaked at about 91% in the 70s, dropped to 83%, and is about 50 to 70% today. And it varies by region, much less in the West than in the Midwest, which has the highest. And it varies by ethnicity, highest in whites, less in blacks, and even lower in Latinos and Asians. And I read all the latest medical literature, but this is 2010 data from CDC. And again, it's about 71% in the Midwest, down to 40% in the West. So the interesting article from last year, B.J. Morris is a big circumcision proponent from down under, and he estimates that about 37 to 39% of men in the world are circumcised. That's useful information to me when I'm counseling of parents who think their child has to be circumcised. I'm like, most men in the world are not circumcised, and they're astounded. I love the range. I don't think you could have a wider range than that. In the U.S., he estimates 71% are circumcised. In Canada, 31, almost 32%. UK, 20.7%. I bring up these two countries because the Philippines and Puerto Rico both became Spanish colonies, and then they were U.S. territories. And look how divergent they are. Almost 92% in the Philippines and less than 1% in Puerto Rico. In Korea, South Korea has a higher circumcision rate than the United States. In the North, it's almost unheard of. And then, of course, in Jewish and Muslim countries, it's over 90%. So why decline in the U.S.? Well, immigration, increased opposition, including child's rights, that you're taking something from them without their consent. The sexual revolution, that maybe masturbation did not harm health. And then I think somewhat the triumph of the scientific process. But a big factor also is denied reimbursement. The increased opposition, this is a letter that just showed up on my desk about 15 years ago from the National Organizations of Circumcision Information Resource Centers. And that's an acronym. Their acronym is NOCIRC. And so this, again, I just kind of serendipitously came across my desk, and it talks about, there are people that feel very strongly, and they were talking about a crucial human rights issue, and the operation caused him excruciating pain and lasting sexual harm, so the 18-year-old was suing a circumciser. I'm going to read you this fine print just because this was an email I got in the last few months from a pediatrician. John, I recently saw a baby from out of state for a second opinion about circumcision that was done reportedly without consent while undergoing a hernia repair that was consented to. This was a fairly standard practice in the 70s and 80s. Well, that kid needs to have his foreskin removed. The surgical outcome of the circumcision looks fine to me. The parents have brought legal action against the surgeon hospital in question. The father of the baby considers circumcision to have been a mutilation of his child, not unlike girls who undergo female circumcision. It is his opinion that the procedure has caused permanent harm to his child. I'm unable to offer this opinion. Is there someone I could refer the father to who might mount a legitimate argument that circumcision, even when properly done, causes permanent harm, reduced pleasure or function or whatever? So I'm not taking sides here. I'm just highlighting that there are some people who feel very strongly about this. The other thing for the residents, don't do procedures without consent. Not a good idea. So this is in Time magazine. Very unbiased. All these articles have very unbiased pictures. And in San Francisco, they actually tried to outlaw circumcision. They weren't successful, but there was a lot about it. And there are even, but at the same time, I was in Los Angeles, and here's the Jewish Journal of Greater Los Angeles, and there's propaganda the other way, but then there's propaganda like this. Foreskin Man. And here's Foreskin Man, and he's about to save this child who's about to undergo a circumcision by a mohel, and the mother looks pretty risque for a woman who just gave birth 8 days ago. But even in the medical literature, I mean, this is like the same month. You've got in JAMA that circumcision is a religious, cultural procedure, not a medical procedure. And then, this article is showing that male circumcision prevents STDs. So the debate never ends. As Dr. Penile said, my father was a urologist. I have bound journals of urology back to the 40s. I was looking up Lapides' article in 72 about clean intermittent catheterization and came across this Lapides' article in 1972 as well, Carcinoma of the Penis and the Anti-Circumcision Crusade. So it will always be a debate in medicine. Well, let's talk about some guidelines, the American Academy of Pediatrics, of which I'm a fellow. In 1975, they brought together experts and said there is no absolute medical indication for routine circumcision. Yet 14 years later, they said newborn circumcision has potential medical benefits and advantages as well as disadvantages and risk, and these should be explained to the parents. So in 14 years, they went from no indication to there are potential benefits. And then in 2012, the most recent guidelines, they say that although health benefits are not great enough to recommend routine circumcision for all male newborns, the benefits are sufficient to justify access for families choosing it and warrant third-party payment for circumcision of male newborns. And it's important that clinicians inform parents of the health benefits and risk in an unbiased and accurate manner. But even that got a backlash. If you look at this article in Pediatrics saying that there was cultural bias, almost all those authors are European. So what was the evidence? Well, they found that the pathological organisms causing UTIs tend to colonize the preputial space. So there is some evidence to back that up. And 95% of infant males hospitalized with UTIs are uncircumcised. Dr. Wiswell, who almost has a better name for a urologist than I do, but Dr. Wiswell is actually a neonatologist. He looked at every child born in military hospitals over a certain time period, and he found that 1.12% of uncircumcised males develop UTIs. Females, it was half that. This is the only year in life in which UTIs are more common in males than females, probably because of the tight foreskin. In the circumcised male, it was a tenfold difference. 0.11% of circumcised males got UTIs. So it's a very effective preventative, but it's only protecting 1%. This meta-analysis back in 2005 found about the same thing. The odds ratio was 0.13, and they felt that the benefit of circumcision on UTI only outweighs risk in boys who had a UTI previously or have a predisposition to UTI. And they felt that it did not support routine circumcision to prevent UTI. What are other benefits? Can it prevent penile cancer? Can it prevent AIDS? Can it prevent balanitis and phimosis that require circumcision later in life? So what about later in life? Because until recently there wasn't much data on this. So this is looking at some market claims data, and these are boys circumcised after the newborn period, and you can see the majority are in the first couple of years of life. But 6.4% of post-newborns were circumcised, and 25% were for non-medical reasons. Obviously, it's a lot more expensive after the newborn period. It was $285 for newborns in 1885. These are actual costs, not charges. This article came out last year, and it's really been great to me to counsel parents with. It was a study from Copenhagen, which they consider a strict foreskin preserving culture. And 5 to 6% of boys are seen for phimosis-related problems. Some days in clinic it seems like it's 25%, but the cumulative risk of foreskin surgery is 1.6%. So that's really good data. They're looking at kids throughout until they're 18, that about 1 to 2% will need to have foreskin surgery. The mean age was 10. 9 needed redo surgery. Why is that? Well, I think in that culture they do partial circumcisions, and I think that scar is beyond the glands and it can constrict down and lead to recurrent phimosis. And the risk of BXO, balanitis erotica obliterans, is 0.37%. So there are going to be some kids who get that and need to be circumcised. What about preventing penile cancer? Well, the risk of a U.S. male developing penile cancer today is 1 in 1,437. And the incidence is decreasing. If you look at the Sayre database, it goes from 0.84 to 0.58 per 100,000 men over the last 30 years. That calculates to 850 cases a year in the U.S. Again, it's maybe protective, but you're not helping a lot of people. 98% are in uncircumcised males, but a lot of it's probably due to HPV. Why do I bring up this Duke data? When I was a resident, I was actually did a lot of research looking at HPV and GU cancers, and about a third of our cases at Duke were HPV 16 and 18 positive. But then I moved from oncology into pediatrics. But what will be the effect of the HPV vaccination? Because that may be just as effective as circumcision, as well as reducing cervical cancer. And this is from a Journal of Pediatrics from the AAP, showing that the HPV vaccine prevents cancer. What about cervical cancer? Looking at some African studies, male circumcision decreases high-risk HPV viral load in female partners. So it may be protective against cervical cancer. Well, the AUA came out with policy 10 years ago. 3 studies from African nations published in 2005, 2007 provide convincing evidence that circumcision reduces by 50 to 60% the risk of transmitting HIV to HIV-negative men through sexual contact with HIV-positive women. Very specific there. While the results of the studies in Africa may not necessarily be extrapolated to the U.S., the AUA recommends that circumcision should be presented as an option for health benefits. So I became interested in this topic, and actually this guy actually gave a talk at the AUA on these African studies. This is one of the studies. It was a randomized controlled trial, beautiful study. They took men 18 to 24 in Kenya, and all were HIV negative at the start, and they randomized them to an intervention, which was circumcision in half of them. And they had to stop the study early because after a median follow-up of 24 months, the HIV rate was only 2.1% in the circumcised group and 4.2% in the control group, so a 53% reduction. If you look at the 3 studies, it was 58% protective rate. One of the theories was, well, they're just not having so much sex because their penis must hurt because they were circumcised. But the South African study showed that the circumcised men actually had more sex. They wanted to show it off. In Uganda, there was no protection to the female partner, and it's less protective for male-male sex. But in this meta-analysis, they estimated with a 100% circumcision rate, they could avert 2 million new infections and 300,000 deaths in 10 years in Africa. And if you look at the circumcision rates, Sub-Saharan Africa, these are the HIV rates. These are very high rates, and these are circumcision rates, and these are very low rates. There's, of course, Northern Africa that's Muslim, high circumcision rates and low HIV rates. What about a Canadian perspective? I read, if this data on HIV prevention can be generalizable to our population, healthcare policymakers in Canada may have to consider whether this procedure should now be covered under our universal healthcare system. The immense cost and training implication of such a policy would have to be weighed against the cost-benefit ratios and other interventions like education, condom usage, and HPV vaccination. It really becomes a huge health policy issue because you'd have to train a lot of people. The CDC back in the U.S. said that parents and guardians should be informed about the medical benefits and risk of neonatal circumcision, and a decision made by the parents and guardians on behalf of their newborn son. And it should be performed by trained practitioners with analgesia, and it's been proven effective prevention with known medical benefits. Financial and other barriers to access to male circumcision should be reduced or eliminated. And so in the U.S., these are states, the states in red are ones that do not cover neonatal circumcision. So we have uneven access in the U.S. I've practiced in Mississippi and North Carolina, so I've only practiced in states where that happened. You can see out west, it's not covered at all, and the West has lower circumcision rates. Let's talk about the risk. We've talked about the benefits. So it's hard to come across good data. One study I found it was 0.5% in the US and 1.2% in Israel. What are the risks? Well, death, that's a pretty bad outcome. In the UK in the 1940s, about 16 boys died a year. They were probably hemophiliacs. Hemorrhage still requires hospitalization sometimes. Infection can be local or systemic. Poor cosmesis can result. Injury or amputation would be the most extreme. Skin loss. Most commonly it's excess skin. That's what we see in clinic a lot. Here's a boy referred to me who had been circumcised, and the parents wanted it to look like what I call a good American circumcision. You can see how much skin I removed and still left him with plenty of shaft skin. This is a common problem that people don't talk about much. The OBs who do most of the circumcisions were in the US don't realize this can happen. These skin bridges where the circumcision line here heals to the raw glands after the circumcision. This is a worse problem, obviously, of amputation. This is with a Mogan clamp, which I don't want to ever have used in my hospital. This was referred to me from another hospital. You can see we put a catheter in the urethra. Fortunately, there was a happy result. This was post-op, and this was a week later. But that's a pretty serious complication, obviously. Somebody sent me this picture from an African boy. Obviously, a really awful complication. Other complications can be meatitis or meatal stenosis because the meatus is now exposed or not protected. Pain, the risk of general anesthesia after the newborn period. When I was a fellow in Houston at a community hospital, a 5-year-old died from an anesthetic complication for circumcision. If you're the urologist, it doesn't matter. You may have been doing the right thing, but if somebody dies, it's a really bad thing. What about decreased sexual sensation? And depending on your bias, is it unsightly? Talking about pain, I was doing a newborn circumcision one time, and I looked down, and I think the kid was, I used local anesthetic, but I think the kid was trying to send me a message. A picture of meatal stenosis. This is not a journal I subscribe to, but somehow this came across my desk one day. And at the bottom it says, "Did circumcision ruin your sex life?" And here's a very unbiased article you can see here. So what is the effect of circumcision on sensation? Masters and Johnson talked about the phallic fallacy, that an uncircumcised male has better ejaculatory control due to decreased sensitivity. So this was the opposite of what Maimonides said, that it actually decreased sensitivity. They looked at 35 circumcised and uncircumcised males, and they tested light tactile sensation, and they found no clinically significant difference. This article in the Gold Journal, the effect of neonatal circumcision on penile neurologic sensation, they measured a lot more than light touch, vibratory touch, temperature, and spatial perception at one position on the glands, and they saw some increased touch and decreased vibratory in the uncircumcised, but it lost significance when controlled for age, hypertension, and diabetes. This article in BJU, fine touch pressure thresholds in the adult penis, they measured fine touch at 19 locations on penises in 68 intact and 91 circumcised adult men. I'm not sure today you could get it through an IRB to touch 19 places on the penis. In 18 positions, they noticed that the circumcised penis had a greater pressure threshold, so decreased sensation, and the most sensitive part of the circumcised penis was the circumcision scar, and the most sensitive region on the uncircumcised penis was removed by circumcision. There's one major problem with this study. It was funded by NoCirc. In fact, Sorrells was the executive director of NoCirc. So many circumcision articles, the people have their clear bias. It's not a hypothesis. They have a bias, and they're trying to prove it. This study came out in JU last year from Ontario. I think it's really the best study I've ever seen. They differentiate between fine touch, which is in A beta fibers, and the punctate, pain, and thermal thresholds, which are in C fibers, which are probably more the sexual function and erotic sensation. And they looked at 32 neonatally circumcised and 32 intact Canadian men, and they found no difference in their sexual functioning based on IEF. And they found that penile sensation did not differ for any stimulus or site for the circumcised or intact men. the foreskin of the intact men was more sensitive to tactile sensation only. So the studies that talked about tactile sensation, there may be a little difference there, but the other sensation is not. And so they felt that neonatal circumcision is not associated with decreased penile sensation in adulthood. One other thought on this, this was from BJU, it was actually a whole supplement about circumcision. This was the effect of male circumcision on the sexual enjoyment of the female partner. They found that all measures including vaginal discomfort, orgasm frequency, multiple orgasm, duration of coitus, and positive postcoital feelings were better with the intact male. So maybe Maimonides got it right 800 years ago. I'll shift gears here a little bit and just talk about care of the intact penis because I think it's a thing that's very controversial and there's no good information. Dr. Penile and I were talking about what we were taught. There was an article from 1949 that said that 90% of 3-year-olds had a fully retractable foreskin. That's just not true. So phimosis can present as congenital, asymptomatic, symptomatic, or the worst, lichen sclerosis or BXO. And the treatment can be observation, can be medical therapy or surgical therapy, which can be circumcision or just a dorsal slit. So I was taught that it's supposed to be you can retract the foreskin by age 3, and you need to teach the boy to start retracting because it's going to be really important to teach at a young age. But this data from Japan really convinced me otherwise. And so they did this grading of typing of phimosis, where type 1 is very tight, and type 5 would be fully retractable. And over time, and here we have infancy to 11 to 15 years, and these are the tight ones, and you can see they go down, and the type 5 become much more common spontaneously, and so there is a tendency that phimosis will go away on its own. And here's the type 1 and 2. The types go from 85% in infancy to 8.6% in adolescence. In terms of medical therapy, using a potent topical corticosteroid, I typically use betamethasone valerate, 0.1% cream, because that's what Medicaid in North Carolina pays for. The original articles were using betamethasone dipropionate, 0.05%. I don't think it makes a big difference. And typically applied twice daily while pulling down. And I had to show parents, you've got to put it on the tight area. Just putting it on the penis somewhere doesn't work. They need to understand that there is a tight area that needs to be softened up. And so you need to show them where to put it. How does it work? The original paper said 85%. These are more recent articles, this one from France. And they studied 462 boys with a mean age of 4 to 5. 6 weeks of therapy, 86% success rate. And with a follow-up of 22 months, only 2% failed. About the same time from Spain, a similar number of boys, similar age. For 8 weeks of therapy, success rate, they included partials, was 92%. They had a lot higher failure rate of 30%. Complications were just some hyperemia and 1 case of paraphimosis. So if you use this, you got to tell the parents not to leave the foreskin pulled back. They found a higher success rate with 8 weeks of therapy, history of prior retraction, and no history of balanitis. What about adhesions? They go away. There's doctors that want to break the adhesions, but we don't see teenage boys with adhesions. They go away. So I say don't break them. Hopefully we've convinced primary care doctors not to do that. It can be painful, and I think they often stick back. And same for circumcised boys who have adhesions after circumcision. They go away. We don't see adhesions, except for the skin bridges that don't go away. And I see people who recommend the steroid creams to try to make the adhesions go away, but I've found no evidence for that. So I also explained to parents that smegma will accumulate. That's not pus. That's the natural process of the skin being lifted off the glands. And it's really necessary for adhesion resolution. So what do you do with the intact foreskin? I mean, you have to begin regular retraction at some age. I, again, was taught that like at age 2 you should introduce it because that becomes part of normal bathing before they're old enough to remember. But I evolved to leave it up to the owner, talking to my colleagues, and Australia, New Zealand, Europe, that basically you can do it with bathing, but no 8-year-old boy is going to regularly retract his foreskin, and the parents shouldn't be doing it for him at that age, and that's why I kind of quit worrying about it. At puberty, yes, they need to do it, but even if you use the betamethasone cream and it becomes retractable, if you're not regularly retracting it, it might tighten back up. And boys 6 to 10 just aren't going to be doing it. It's hard enough to get them to take a bath. But if you do it, just do it as far as comfortably possible. And I tell parents not to use soap in that area because it can irritate the delicate tissue. And then to bring it back in a normal position to prevent paraphimosis. Kind of to wrap up, I went and looked up what the Canadian Pediatric Society recommends. And they do not recommend routine circumcision. And physicians and others caring for newborns must stay informed about circumcision, so that's why I'm here, and assist parents in understanding. They need to receive the most up-to-date, unbiased, and personalized medical information available, and parents choosing circumcision should be referred to a practitioner trained in the procedure. Neonatal circumcision must be performed by a trained practitioner whose skills are up-to-date and strictly adherent to hygienic and analgesic best practices. So still using that word hygienic. Close follow-up in the post-circumcision time period is an idea to prevent those adhesions from occurring. And the healthcare provider should ensure parents of uncircumcised newborns should know how to appropriately care for son's penis and are aware that normal foreskin can remain non-retractile until puberty. I've never seen this before, so kudos to the Canadian Pediatric Society that you don't need to worry about it in prepubertal boys. Quality Canadian data are required to understand the clinical and economic issues involved in neonatal male circumcision, including its potential risks, benefits, and cost in the Canadian context. So that was in 2015. I went on PubMed, and of course there was a bunch of articles, for and against what the Canadian Pediatric Society, because everybody's got an opinion, and every time there's an article, there are people who write that we shouldn't be doing circumcision and people writing we should. So it will never end. In your whole career, you'll continue to see this. I thought that, given the weather I've seen for the last 4 days, that I just had to go onto Google and get an image of a pretty day in Vancouver. But yesterday I walked down to Gastown and actually I could see the mountains. So it was a pretty day. And you live in a beautiful place. If you're interested in learning more about the history of circumcision, a lot of my historical thing came from this book, a really fascinating book titled from the quote of in Genesis, marked in your flesh. Thank you.